We begin with the stalemate on healthcare funding. Amid a crisis in Canada's hospitals, the feds and provinces are trying to reach an agreement on more money. But talks this week collapsed. Manitoba Premier Heather Stefanson is the chair of the Council of the Federation, which represents all of the provinces. She joins me from Winnipeg. Premier Stefanson, I understand that you and your colleagues are quite frustrated with the federal government right now, but I had to ask you about the events this week where this letter, this press release that the premiers wrote days before the meetings began in British Columbia, released hours before the meetings ended in British Columbia, calling the meetings a failure, and yet you're calling the federal government the unwilling partner here. I mean, how are Canadians supposed to reconcile all of this?
Well, I think what it is David, is that we have put a proposal out there for the federal government. It's now been well over 2 years, and we've yet to even sit down at the table and have that discussion. And I think what Canadians want to see from different levels of government is that they're working together towards coming to a solution to this challenge. We know that healthcare is one of the most important issues to Canadians out there, and they want to see us working together. And we're hoping to be able to sit down at the table and have those discussions. Well,
we were in Victoria this summer when Jean-Yves Duclos sort of made a meeting of health ministers a precondition for the first minister's meeting you're looking for. And this was the meeting. It was happening in British Columbia. And you say you want to work together, but how is it working together when you've got a draft news release ready to go, calling the talks a failure even before they begin?
Well, I think, what the challenges are, David, is that we're not sitting down as premiers across the country, sitting down in a First Minister's meeting. This is what we have said all the way along, that we need to be having discussions at the First Minister's table. And that's what we've been calling for. And we've got a proposal out there. Again, if the Prime Minister has a proposal, we just want to sit down and have those discussions. That's the appropriate table for it to take place at.
But the federal government has some preconditions on that meeting, right? They want to see some agreements on data collection and information sharing and some conditions put in place before you get to that meeting. And that's what was supposed to happen in British Columbia. And Minister Duclos came out of it saying that the premiers wouldn't let the health ministers do their work. Is he right to say that? Because it sounds like you don't want any conversations except at the premiers and prime minister's level.
No, it's not true at all. And what I would say is that, we've always said all the way along that the most appropriate place to have those discussions is at a First Minister's meeting. This is discussions about, these are budgetary discussions, and it's about the future of healthcare in our country. We know how important this is, particularly coming out of a pandemic. And we're just hoping that we can sit down at the appropriate table and have those discussions, which is at a First Minister's meeting.
So how does what happened in Vancouver help you get that meeting? Issuing this statement before the health minister's talks were over, calling them a failure. I mean, how does that help build the trust to get to the point where you can sit down with the Prime Minister and have this conversation?
Well, what we need to see from them is some sort of a proposal. We haven't seen anything yet from them when it comes to this. And so, we have put our proposal out there as premiers across the country. And what's unfortunate is that we really haven't seen anything from the federal government about this whatsoever. We have said time and time again that the appropriate place to have this discussion is at a First Minister's meeting. We are ready to have that meeting anytime now, that they are available to do that. And I know as premiers across the country, we stand united on this front to ensure that we do what's in the best interest of Canadians, and that's get them more health care sooner and closer to home.
Right. So when you say you haven't seen a proposal from the federal government, I assume you're talking exclusively on long-term funding arrangements, because there have been proposals from Minister Duclos on data collection and sharing and sort of benchmarks and measurements on transparency in the system. Is that what you're talking about solely on the money side?
We have not seen any proposal as premiers from the federal government whatsoever. And not on the Canada Health Transfer, and that's what we've been asking for some time. I think it's time now to put everything aside for us to sit down and to do what's right for Canadians to get them the health care that they need.
So you said a second ago that premiers are united on this. We've heard that before from premiers in 2016 and 2017, the last time there were big talks about health care increases. And we saw Jane Philpott and Bill Morneau go around and cut deals one by one with province after province until they had everybody on board with their conditional money and not the no strings attached across the board increase premiers were looking for. Are you concerned you might see a repeat of that happening now, that provinces that really need cash are enticed to sign deals with the federal government and your unity evaporates?
Well, what I do know that certainly as premiers across the country that we are united on this front to ensure that we get that increase in the Canada Health transfer to our provinces. And again, we're looking for the federal government to come to the table on that front. I mean, I would hope that we could stop playing games here and just do the right thing. And that is to sit down at a table, have an open dialogue about the future of healthcare in our country. I think Canadians are looking for that, and they deserve it.
What do you say to Canadians, though, who look at this, Premier, and say really kind of all sides are playing games? I mean, you've got some provinces that can't fully account for some of the COVID money they got. There's unspent healthcare money in their budgets. I know you're looking at a review of business and personal income taxes, which would be cutting off revenue at a time when you're saying you don't have enough money to pay for these core services. There seems to be a lot of politicking happening on this while emergency rooms are overcrowded, pediatric medicine is in short supply, and sort of a country and a healthcare workforce kind of doesn't care if the health ministers sort it out, the finance ministers, or the premiers sort it out. So what do you say to people who are looking at all of this and are frustrated by what's happening?
Well, more and more of what's happening is that healthcare is becoming a larger portion of our provincial budgets. And we know certainly in Manitoba, and the average across the country is it's about 40% of our budget. We spend 78% of it. The federal governments contribute 22%. That used to be a 50-50 split.
It's higher than 22% when we look
to,
at the tax points. Sorry to interrupt you, Premier. I don't like to do that.
Well, I have to say it's certainly not 50-50. I will tell you that much.
But it could be 30 to 30.
There's a reason why we need to move forward.
It may be closer to the 35% you're looking for than the 22% you say it is. I mean, there's been some analysis that put it at 29, others that put it as high as 33. The 22% is not an accurate reflection of the contribution to the healthcare system.
What I will say to that, David, is that it's becoming increasingly every year more and more a percentage of our provincial budgets healthcare. And so that encroaches in other areas like education,
right,
social services, other areas that are needed. And so that's why we're asking the federal government to get back to, I mean, we're not even saying get back to the 50-50 split where this started, but they need to come to the table so we can at least have these discussions. That's all we're asking for.
Yeah, and I certainly don't want you to think I'm understating the challenge provincial governments are facing on this. That and debt servicing are eating up more and more of the budgets. But I guess a final question, Premier, before we let you go is, the Prime Minister and the federal government has said they want meaningful conversations to happen at the health minister's table. You say it can only happen at the first minister's table. Where do we go now? Because the health minister's talks didn't work, and there are no first minister's talks scheduled as far as I can tell. So what happens next to find a solution on this?
Well, I think it's pretty clear. I think Canadians want to see this. This is one of the most important issues that we face across our country. The Prime Minister knows that, and he knows that he should be the one sitting down at that table along with the premiers across the country. It's incumbent upon us as the leadership of this country to sit down and have a discussion about one of the most important issues that we face in our country.
Okay, Premier Stefanson, thank you so much for your time.
Thanks very much, David.